could you introduce yourself and give a brief description of your journey to becoming a pediatrician?
Yeah. So my name is Sarah Vater. I am a pediatrician at Princeton Nassau Pediatrics, and I live in Princeton, New Jersey with my husband and my two daughters. One is 3.5 and one is 7 months old. So I decided I wanted to do medicine, become a doctor, sometime in late high school, like junior year, senior year. And it was a little bit because of a TV show called ER with George Clooney. But I was interested in science and helping people. Those were the two things I knew. So I had some experience working in a lab, like a bench lab, doing tissue culture and petri dish things and PCRs and DNA stuff. But as I went through that and a little bit of that in college, I decided that that wasn't quite connected closely enough with helping people. I definitely believe in scientific research and that it does help people, but for me personally, I couldn't quite see the connection directly to helping people. So I knew I wanted to work directly with people and helping them, which fit with medicine. So in college, I got more interested in public health and international health, and that's what I ended up majoring in and doing my studies in. And then I found a mentor at the end of my senior year of college, and she was an OBGYN, so she worked in women's health, and she got me interested in women's health. I was particularly interested in helping women at their most vulnerable time, which I think is pregnancy, being pregnant. And that's when I really wanted to be a resource and a provider for people. And so I did some clinical research in OBGYN and women's health. And then I went to medical school and sort of kept my options open, but always wanted to do OBGYN and women's health. And I had my pediatrics rotation kind of tagged onto my last rotation of the year, not really thinking anything of it, just, well, I have to get this done. And I think it was about 10 days or 2 weeks into it when I realized that I had to switch everything around to become a pediatrician. So it wasn't any magical experience, but it was like consistently day to day going in and seeing babies and kids and even like teenagers. Yeah. Actually, especially teenagers. I really liked interacting with them. And I realized that I think working with the parents particularly, which is that's really what sets pediatrics apart from other types of medicine, is you really are kind of working with the parents for a long time, for pretty much throughout life, and then even into young adulthood, I still want the parents to be involved and stuff. And so I really thought that was special, and I really liked doing that. And then I realized that I think being a parent is one of the most vulnerable times for someone, rather than being pregnant. But on the other end, when you have the baby, I think that's the most vulnerable time. So I realized, this fits what I want to do anyway. So that's perfect. So I switched everything, and that's how I became a pediatrician. And I'm very happy with my decision. I love my job. Yeah.
So what does a typical day look like for you?
So I come into so I wake up, get the kids and the baby fed, and I kiss my husband goodbye, and I come into work, and I log into the computer, and I look at my schedule, and usually I have between 12 patients up to like 22 or 23 patients. And our busy season in pediatrics is the winter, because everyone gets colds and gets sick, usually in the winter. So that's how many patients a day that I usually see. And I sometimes take some time to look through the charts throughout my day and read a little, how'd my last visit go with that baby, or what did we talk about last time, or refresh myself on, like, if I'm seeing a 16-year-old for their checkup, like, what sport were they playing last year? Let me ask about that kind of stuff. Sometimes I don't have time to do that in the morning. I just have to head right in, and I kind of get a little bit caught up in the room. But generally my memory is always jogged by seeing the parent and the patient's face. And so then I just do checkups, and we talk about how the year has gone, or with babies and checkups, they have them every, 1 month to every 3 months. So I'll say, how was the last couple of weeks since I last saw you? And no matter what age, we always at their checkup visits, we talk about development. And so for like a baby, it's, have they rolled over yet? Oh, that's great. Let me see on the bed. So let's roll them over.
Okay.
For a 15 or 16-year-old, it's like, okay, how are your friendships going? Any drama? Are we dating yet? Are we thinking about it? How much are you using social media? All of that stuff is kind of in the developmental realm. And then we talk about growth, like how much, like weight, height. Babies, we measure their head, how big their head is growing. And then we give vaccines for the checkup visits. And then I see sick visits too, is what we call them. So when someone comes in with a really bad cough or a cut on their arm that they may need like sort of cleaned up, and sometimes I'll use the skin glue and I'll glue it back together, or if they sprain their ankle or something like that, I'll see those too, and they're just like mixed in through the day. And then I answer phone calls too, so I get a lot of messages. So-and-so's mom just wanted to double check and make sure that it's okay to give them this much milk in the day. And so I'll call back and I'll talk with the mom or dad or send them a message. And then that's pretty much it. That's the day.
Would you say it's like busy, tiring, or like enjoyable?
It can be. It's a mix. I think there are days when I feel like I'm always catching up. And those are tricky because I'm worried about, oh man, did I remember sending that prescription for that, diaper cream or something like that. And sometimes I do forget. I'm like, we don't forget the big stuff. When things are important, when a kid is really, really sick and they need to go to the hospital and I need to call the person in the hospital to say what's going on, and this is what I think they need an oxygen, I think they need a chest x-ray, something like that. That is always kicks everything else down. So it's something we call triaging in medicine. So you assess the level of danger and safety and things like that for babies up to adolescents and young adults. There's all different kinds of triaging, but in like an outpatient doctor's office, if someone is sick enough to be going to the hospital, everything falls off and I take care of that patient right away. And I get help if I need. Once that's taken care of, I'll leave little notes for myself, double check, follow up with the family tomorrow, make sure this, and this. And then I'll check where I am, how far behind, how many patients are waiting for me. I'll pop in my head and say, I'm so sorry, I'm running behind. I'll get to you in a minute. And so then I sort of tie things up as it goes. But those days are tricky for sure. And I'll be on the drive home and I'll get home and I'll be like this. And then the, 3.5-year-old will come, Mommy, let's play. But I still enjoy those days. I mean, I still, I feel that I helped people and things like that. And then there are really slow days when I'm like, looking up a recipe to cook that weekend that never gets cooked anyway. But, it's kind of an ebb and a flow. Yeah.
Okay, so now, moving on to like early childhood development, what are some factors in a child's environment that can impact their growth throughout their life? Yeah,
like their developmental growth over their life. So I think there's probably some different like views and maybe opinions on this, but I think everyone would agree that the caretaker, like mom, dad, or grandparents, or aunt, uncle, or adoptive mother, father, things like that, that's probably the number one thing that's most important in a baby, an infant, a baby, and a toddler's and a child's life, is the caretaker and the people that are interacting with them and around them. Certainly, like, so basically a present caregiver, like someone who is there, not always constantly, hovering, but, when a baby cries, instinct is to pick them up, and generally that's the right thing to do, right? And so I could talk about this all day, but basically you want a present caregiver that's responsive to the baby's and the child's needs. And that changes over time. So, a baby crying is different than a toddler throwing a lot of temper tantrums, which is a lot harder to have patience with and respond to, but something is probably going on there that toddler needs a little bit of help with. And so, either you talk to your pediatrician or you talk to your mom and you say, Mom, was I like this as a baby? What should I do? Or you talk to your friends and things like that. You read books. And then an 11-year-old who all of a sudden gets really quiet and is always in their room, which they've never done before, and they're not talking to their friends anymore. Something's going on. And so the caregiver needs to notice that and respond. Okay. And then there's definitely importance of toys and play. Like, I think another super, super important thing that I always talk about is open-ended play and unorganized play is really, really important, particularly for toddlers up to kind of like school-aged kids. So I would say like 9-10 years old, which is a big range of childhood. So like 2-3 years old up to 9-10 years old, like taking them to the playground and saying, go play. And sitting there, make sure they're not like jumping off a 7-foot surface or anything like that. But letting them interact with other kids of different ages and getting toys taken from them and learning how to respond to that and learning what happens when you take a toy from someone else and learning how to go up and say like, hi, I'm so-and-so. Do you want to run and play with me? Or, look at this bug bite I got. It's just all part of learning how to interact and socialize. So a lot of that is really important. And then younger, when they're babies and they can't go running around the playground making friends, I think toys are important. They're really simple things, so I think everyone would agree giving a cell phone to a baby just to hold and look at is not a good idea, right? But giving I think this is a good example. So if I gave this is a kind of funny looking water bottle, but it's rubber and it's soft and squishy, but it's a really interesting texture. I think even for adults, we kind of want to touch it and stuff. But I could give this to my 7-month-old and have her kind of look and feel the weight and how the water shifts and how it feels when it drops on her lap and how it feels on her teeth and her gums. And there's a bunch of stuff to just learn about an everyday object. So I think those are some of the important aspects of development. Yeah.
And this is nutrition related, but how do you suggest parents introduce children to healthy eating habits when they struggle with their own nutrition?
Yeah, I think that's probably one of the most difficult things especially in America. We have, an obesity epidemic, and we see a lot of overweight children, toddlers, children, young adults, and they struggle, and it's it can be a really hard thing to bring up. Because obviously you're never, especially as a doctor, saying, you're too fat, you need to lose weight. That is absolutely never the case. But we want kids to be healthy, and we want them to make good choices about their food and their diet and get into good exercise habits and be active and be outside and not staying inside playing video games for 6 hours when they're only 8 years old and they should be running around the playground, like I said. But these things are lifestyle things. They're often really it's all about the family dynamic at home. And so for me to come in as sometimes a stranger, sometimes this is the first time I'm ever meeting this family, but even as someone I've known for a couple of years and stuff, and say, well, you guys really shouldn't do that in the evening. You should go out and walk a mile instead as a family. That's not that's judgmental. It's not helpful. No one's going to listen to it, even though that may be the case. Maybe they should be getting out and walking a mile every night. So it becomes kind of, you have to practice being really tactful about it. But like you said, it really has to do with the family and everyone making kind of the same healthy decisions. I think it's about balance. Again, this is something that I think you'll get different opinions from everyone on. So there's some people that will say, plant-based, heart healthy diet, no meats, all whole grains, which is great. I think that's fantastic for people who that works for. There are a lot of people who just don't have resources like money to keep up that kind of diet, and the time. That takes a lot of preparation and going grocery shopping frequently, because vegetables and fruits spoil easier than processed foods. And so some families just don't, the parents are working sometimes 2 jobs, or they're doing the mom works during the day, the dad works during the night, and there's hardly any overlap. And, all the 3-year-old wants to do is spend time with her mom and dad. And to go into the kitchen and prepare a really healthy meal for an hour is just not possible. So it's really about learning the family, figuring out what the dynamic is, offering the normal, we always have the food pyramid, so grains, whole grains, fruits and vegetables, minimal candy and sugar and super salty chips and things like that. So we always have those guidelines, but to me, I think the most important is, like you said, talking with the parent about how the family dynamic is and the habits that they're getting into. So if it's a habit of them to always have cookies for a snack, but you can tell the kid really likes sweet stuff, maybe we try a couple times a week, instead of cookies, we'll do fruits with some yogurt, because that's still sweet. And if we can change kind of the palate of their taste a little bit, and they're like, oh man, this fruit is kind of good with a little honey and a little, whole milk yogurt, stuff like that, that's better than cookies. It's not ideal, but it's better. And so I think it's a balance. I love candy and I love Cheetos and I love pizza. So like, I think balance is appropriate, especially in America, and you're going to birthday parties and you don't, it's hard not to eat pizza when everyone else is eating pizza. So yeah, that would be my 2 cents. Again, another thing that I could talk about for hours.
So what challenges do you face as a pediatrician, and what do you think is the most rewarding part of being a pediatrician?
I think the challenges are this is a really tricky question. It's really difficult to see a really sick kid. It's hard. I mean, it's basically it's impossible not to get emotionally tied into that and the family. And I think it's appropriate. Oftentimes in medical school, you're taught how to be empathetic, but not sympathetic. So showing empathy and saying, yes, I understand, I'm really sorry, grabbing the tissue box and handing the tissue box, but not to get too, hugging everyone, giving out cell phone number, call me if anything comes up, like not overstepping and overreaching. And everyone has their own style, but I think particularly in pediatrics, it's really hard not to, if one of your patients that you've known for a long time is in the hospital with a new cancer diagnosis, we go to the hospital and we sit in that room for hours with the family. I mean, we're not a part of the family. We don't want to inflate our self-importance, but like we're at home crying about that patient. And that is really hard. It's really hard to see, not that anyone ever deserves illness, but an adult who, has like kind of let themselves go, or like, maybe been a little bit at fault to why they're, not doing well health-wise, versus a kid who just all of a sudden randomly gets cancer is really, really difficult. So that's probably the biggest challenge. Fortunately, it's very, very rare, and it hardly ever happens, and we get through it, and the kids get through it, and that's like, I think, probably leading into one of the most rewarding things in pediatrics, and not just cancer's obviously sort of the most serious thing, but even like a really bad pneumonia can lay up a kid for weeks that was like a really healthy lacrosse player, and like running around the field, and all of a sudden is out for like weeks and months, missing school and like not able to breathe right because of the pneumonia, something like that. But they almost always bounce back.
That's good.
And so seeing them at the end of it, seeing them, go through weight loss, hair loss, chemotherapy, on oxygen machines, and then on the other side, like getting back into like, the bounce house and on the lacrosse field, and like, running around being a stupid kid with her friends type of thing, is like, there he is. There she is. Like, she's back. She's got it. And so that, I think, is the most rewarding. And that is much less frequent of a bounce back in adult medicine and older. And I have so much respect and am in awe constantly of adult medicine physicians and how they treat chronic disease. We definitely have chronic disease in pediatrics, but it's fewer and farther between. Most kids just are really healthy, and they just they get sick, but they're back in action. That's really rewarding.
Nice.
Yeah.
Thank you so much for the interview.
Of course.